Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, my guest today is broadcasting all the way from Spain. She is 21 years old and studying both medicine and nutrition. Please welcome to the show, Mariana Fernández. It's so nice to meet you, and I'm so sorry it took so long to get you on the show.
Yes, it's a pleasure to be talking with you today, Chef AJ. I have been following your work for lots of years. Well, lots of years, 2 or 3 years. I started to follow you, and since then I have met lots of plant-based doctors thanks to you. And I love your recipes, your sweet potatoes, and everything you do. So yeah, I really love your content, and you are for me a source of inspiration. Yeah.
Well, thank you. Well, you're an inspiration too, because first of all, you're only 21 years old, and my understanding is you went vegan when you were 15. Can you tell our viewers why you did that?
Well, my story starts like 10 years ago when I was 11, because at that age I was diagnosed with a Hodgkin lymphoma, which is a
Wow.
type of cancer. And at that time, my mom, some months surgeon, was diagnosed with a breast cancer. So at that moment, I was receiving my chemotherapy, and in that period, I started to get interested in eating healthy because I wanted to be healthier. I wanted to prevent disease. I wanted to be in good health. So I started to do my own research, but at that time I was just 11 years old, so I didn't have like a good knowledge about scientific evidence and how to interpret it. So I started to read books, and I started to change my diet towards a more plant-based diet and less processed diet. And when I was 14 years old, I discovered Michael Greger and his fantastic book, How Not to Die. And I found that book, I read that book, and I started to see all the scientific studies that supported plant-based nutrition. And in that moment, I got introduced into science, evidence-based nutrition, and I started to do my own research in PubMed, and I started to learn how to interpret scientific studies. At that time, I eliminated all the animal foods I was consuming. At that time, I was consuming a very low amount of animal foods, but I turned vegan. I eliminated all of them, and it's 7 years since then. So I turned to a whole foods 100% plant-based diet, and I started to read all the scientific studies that supported this lifestyle and diet, and I was so impressed that it became my passion. And and the thing is that here in Spain, uh, this plant-based movement is not very well known by doctors and health professionals, just because I don't know if they don't read the evidence, if they don't know how to interpret it, but it's not used as a tool for disease prevention and reversal. Instead, it is seen as a dietary pattern that can be chosen if you, for ethical reasons or just for environmental reasons, but it's not seen as a healthier option when evidence, scientific evidence shows clearly that as the consumption of healthy plant foods increase, so decreases the incidence of chronic disease. So it's the dietary pattern that health professionals should be advocating. And it is not that a healthy plant-based diet, a healthy vegan diet can be nutritionally complete, of course, but it is superior to omnivorous diets. And this has been scientifically proven. So this is something that is not, I don't find doctors in Spain that know of this. So I, 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 I follow American plant-based doctors. I follow British plant-based doctors. I follow their works. I'm constantly reading scientific articles, and and also follow the work of nutritionists, plant-based nutritionists from the United States and so on. You know, Neil Barnard, Michael Greger, Dean Ornish, Esselstyn are my inspiration. Also, of course, other doctors such as Alan Goldholmer, I mean, all the plant-based doctors you interview are
Can
my
I ask,
source of
I don't mean to
inspiration.
interrupt, but I don't want to forget that I want to ask you a little bit more about when you had the lymphoma. You
Yeah.
were 11 years old, right?
Yeah.
How did you have any symptoms? How was it diagnosed? And was your mother's breast cancer at the exact same time? So you both were undergoing treatment at the same time?
Yeah. Yeah. Well, my mom was diagnosed some months earlier, just like 3 or 4 months, more or less. And she was receiving her chemotherapy when I was diagnosed. So sometimes we have at the same time chemotherapy. We both had at the same time chemotherapy, and I diagnosed my lymphoma because one day I started to realize that I had like a ganglia in my neck. So it was like a little bit itchy, but it was not very painful. But I realized that something was there, and because of that, I told that to my mom, and we decided to go to the pediatrician, and I have a I don't know how it's called,
Echocardiogram?
no, echocardiogram, no, normal echography. And they saw that it was a ganglia, that it could have, it could be a lymphoma, and then I had like a more scan test, and CTA scan test, and yes, it was a Hodgkin's lymphoma, and I received my chemotherapy for some months, and at the end of the treatment, I started to change my diet towards a more plant-based diet. I reduced dramatically my animal food consumption and my consumption of ultra-processed foods, and since then, my treatment was finished, and since then, I haven't had any type of relapse, and I'm okay. So it's great. Yeah.
Right. What was going through chemotherapy like in general, and really at a young age? Were you scared? Were there side effects? How did you feel going through it?
Well, I must say that well, the first cycles of chemotherapy were like were hard, because I started to have lots of digestive issues. I was in pain. My stomach was very, very painful, and I had terrible digestion. So they didn't know why it was, but at the end of the treatment, months later, I had a colonoscopy, and it was seen that I had had some kind of inflammation in my gut due to infection during chemotherapy. So maybe that's the reason why I have those that such a acute pain in that period, and I was also feeling like very tired. But it is true that when I started to change my diet, I started to feel much better, and my stomach pains. I started to change my diet at the end of the, more or less like in the last mid of my chemotherapy, in the last cycles, And then I changed my diet and I started to do daily exercise, and my symptoms improved dramatically because my digestive issues improved, and also I felt with lots of energy, and I was also experiencing bone pain, and that disappeared, and I started to do like lots of exercise, feeling like great and having like a normal life, even though I was undergoing chemotherapy. When I finished, well, that I felt with energy and well, and of course that at the first time when I was told I was gonna have chemotherapy, I felt like a little bit scared, because at that time I didn't know exactly what was chemotherapy, and what I knew is that it was like a very hard treatment, and I was gonna feel terrible. But it is true that once you process that, and it wasn't extremely hard for me. I went through it, and I think that it wasn't like a trauma. I knew I had to have it, and I was very optimistic.
Wow. Did your mother change her diet as well?
Yeah, absolutely. It is true that at the beginning, my parents and even my doctors also were like they were not, they didn't want me to change my diet. They thought that a healthy diet was a diet composed of animal foods, and plant foods, but they didn't know about plant-based nutrition and all the scientific evidence that shows that is the optimal dietary pattern. But they didn't know of that. So at the beginning, it was very hard. It was very hard because I was very young, and they thought that my diet was not good, or they didn't want me to change my diet. And that's also the reason why I didn't start completely vegan until I was 14, because when before that, my parents and my doctor were like saying, no, you cannot abandon completely animal foods because, iron, protein, things like that. And I was like fed up with all those non-scientific arguments. But as I started to investigate more in plant-based nutrition, I started to know more about nutrition, all the scientific evidence. My mom, my parents started to realize that it was the diet it was the best option the best diet we can follow. And when I turned vegan, when I was 14, 15 years old, my mom also turned vegan, and we are vegan since then, and we follow this lifestyle. And my mom right now advocates for this diet because she has also experienced a very she feels great. Her disease is in control, and she's in remission. So that's great.
That's fabulous. I don't know what in Spain in general, what the diet is. Here in the United States, we talk about the standard American diet. So what kind of foods were you and your mom eating before your cancers, and what kind of foods are you eating now?
Okay. So here in Spain, most people follow like a Western dietary pattern. Even though the traditional dietary pattern here in Spain was the Mediterranean diet, right now people eat lots of animal foods daily, like meat, chicken, processed foods like biscuits, bars, pizza and cheese, lots of animal foods. People eat lot of animal foods, and that's something I see when I go to supermarket and I look at what people are choosing, and I think, oh my God. And also, if you look at scientific evidence that scientific studies that look at what Spanish people eat, they have like a very high consumption of animal foods and processed foods, and their consumption of plant foods and whole plant foods and processed plant foods, it's low, and in consequence, the obesity rates and overweight rates are increasing here in Spain dramatically. Diabetes and cancer, but the obesity problem is increasing each year, and it's dramatic. Yeah. So my diet was a typical Western diet. I didn't eat vegetables. I didn't like it. I didn't like them. My diet consisted of meat, potatoes, dairy products, some processed foods. I didn't eat eggs because I'm allergic to eggs. But my diet was like very it didn't have many lots of variety. It was like milk, some fruit, but very little vegetables, almost no vegetables, and potatoes, fish, meat, and some processed foods, and that was my diet. My mom, she used to eat more vegetables, but not a lot. I mean, we ate animal foods in lunch and dinner, and in breakfast with dairy products, and very typical Western dietary pattern. And well, when I changed my diet, it was like something I gradually changed my diet, and I started to eliminate all the processed foods, to reduce my consumption of animal foods, and I started to include vegetables and nuts and legumes and whole grains and so on. And finally, when I was 15, I turned vegan. So since then, my diet is 100% whole foods, plant-based diet. My diet consists of fruits, vegetables, legumes, whole grains, no oil, no sugar added, no salt added, SOS free. And it is true that I include also nuts and avocados because they are nutritious and they have lots of antioxidants. But it is true that as the calorie density is higher, the fat content is higher, it is true that I consume them in very small amounts as a condiment. I include them daily, but as a condiment because they provide benefits, but you don't need a lot of that. With a small handful of nuts, or just have an avocado, or that's more than enough. So that's my diet, but the fruits, vegetables, legumes, whole grain, and sweet potatoes, I eat those ad libitum. And yeah, that's my diet.
Wow. Can you tell us like maybe what you eat in a day, and do you exercise?
Yeah. Well, I exercise every day. I walk a lot every day, at least 10,000 steps a day, at least. And I also have like a treadmill here at home. So I'm like Michael Greger. While I'm working with the computer, I have the treadmill, so that's great. And I also do like resistance training here at home. I have like a mini trampoline, that's my exercise daily routine: walking, mini trampoline, some strength exercise at home. Yeah. And what I eat in a day, well, in the morning I have whole fruits, maybe 2 or 3 pieces of whole fruits. And I also have, in a small bowl, I have some rolled oatmeal with flaxseed. Later on, in lunch, I always have like enormous plate of steamed vegetables and raw vegetables, like lots of veggies, like broccoli or aubergines, courgette, butternut squash, whatever, vegetables, steamed vegetables. And I also have cooked legumes or cooked whole grains. I normally cook legumes, and other days cook grains such as quinoa or buckwheat, and I add to it some avocado. And that's normally the structure of my daily lunch. And dinner consists of steamed vegetables again, and sweet potato, and some fruit.
That's wonderful. Did you want to share some slides and talk about something in particular? I know you actually said you published some research. I'm very curious, in your medical school or in your nutrition program, is nutrition even talked about?
Well, I'm studying both degrees. So in the medical degree, no. In nutrition is something that is not taught. We don't have subjects about nutrition. We just have like one subject, and that it's called endocrinology and nutrition, but it's like a part of a subject, but the content that is taught about nutrition, it's very, very little. So it's almost nothing. And so in the medical degree, no information. And as I'm also studying the degree in Nutrition and Dietetics, of course, then we are taught much more information about nutrition. But I think that they don't provide enough information about the potential of plant-based diets in the prevention and reversal of disease. And sometimes they focus a lot on the nutrients foods have, but not so much in the impact that each food group has on disease risk and mortality. And I think that it would be better if this degree would focus more on the scientific evidence regarding the effects of foods on disease risk and prevention, not just the nutritional components and physiological functions, which, okay, but we want to look at the effect of food on heart endpoints.
Yeah. And so there's not much of a big vegan community in Spain.
No. Well, there are vegans, there are people who follow plant-based diets, but they don't advocate, they don't advocate this diet because of it being healthier, but instead because it's more sustainable, for ethical reason, which is also true, and I do also this because of that. But we also have to say that it's healthier, that the healthy omnivorous diets, such as the Mediterranean diets and all these dietary approaches that include animal foods, and as I'm gonna talk in the presentation, a 100% plant-based diet has shown to be superior to other diets that also include plant foods a lot, but still include animal foods. And a 100% plant-based diet has shown to be superior to that. And prospective cohort studies show that as the proportion of plant foods increases in the diet, the risk of cardiovascular disease, cancer, diabetes, and so on decreases. So there is a dose-response relationship.
Nice. Well, if you'd like to share your slides, I'd love to see your presentation.
Oh, yeah, of course. I'm gonna try to.
That's incredible that you've published research and you're only 21 years old.
Yeah, some months ago, my first paper was published in Nutrition Reviews. Right now, I'm gonna show it also along with the okay, I'm gonna try to
Yeah, you want to click, there you go.
I don't know if I can see the Zoom. I'm gonna
It said you started screen sharing, but it's just a black screen right now.
okay, so you can see right now?
I can't see your slides. It says that you started sharing, but there's nothing up on the screen.
Oh, it said that it's loading.
Oh, there you go.
Okay. Can you see it okay?
I can see it. I can see your whole desktop, but yes, I can see it. Yes.
Okay. So yeah, my first scientific article was published some months ago. It is called, well, later on we are gonna see it also. And yes, it was published in Nutrition Reviews, and in that paper, I talk about the impact of plant-based nutrition, healthy plant-based diet in diabetes treatment and prevention. And here in this presentation, can you see it?
Yes, whole food. Yeah, I can see it perfectly.
Okay. Well, in this presentation, I'm gonna try to describe the key points, some key points about the role of plant-based diet in the prevention and treatment of type 2 diabetes and pre-diabetes also. And also I'm gonna show later on the scientific, some of the parts of my scientific article, so that there you have all the scientific reference I'm gonna base right now, and also like a picture in which I show mechanisms by which a plant-based diet decreases the risk and improves type 2 diabetes. So let's start with, first of all, we have to know a little bit about how blood glucose levels regulate. And this is crucial so as to understand how diet can prevent type 2 diabetes, or can increase the risk of type 2 diabetes. So blood glucose levels is maintained by a balance between the endogenous glucose production and also the glucose that we absorb from the diet. Carbohydrates provide glucose, so then we absorb them. And also depends, our blood glucose levels depend not only on the endogenous production, not only on the carbohydrates we eat, but also on the rate of tissue glucose uptake. I mean, our liver, our skeletal muscle uptake glucose, and all our tissues uptake glucose. So depending on the rate of their uptake, glucose will be higher or lower. How this is regulated? Well, beta cell insulin secretion and skeletal will enable insulin will enable glucose to enter tissues, but also it's important the skeletal muscle and liver insulin sensitivity. It's not only important to produce insulin, but it's as important that that insulin works properly and can introduce that glucose adequately into the tissues. That is called insulin sensitivity. Well, what are normal blood glucose levels? Blood glucose levels range from 17 milligrams to 100 milligrams in the fast state. And in the postprandial period, what are normal glucose levels? Well, less than 114 milligrams in the 2 hours after ingestion. When you undergo an oral glucose tolerance test, it is said that you have normal glucose tolerance if after the ingestion of a glucose load of 75 grams, you have a glucose rise in blood that is inferior to 140 milligrams. That is considered normal glucose tolerance. So what happens when we ingest, when we consume foods that have carbohydrates? Those carbohydrates are degraded by digestive enzymes, and then glucose can be absorbed. As a result of glucose absorption, glucose increases in the blood. The concentration of glucose increases in that postprandial period. But the thing is that if you have normal glucose tolerance, the rise in glucose tolerance that you are going to experience will be less than 140 milligrams. Glucose in the blood then is uptaken by peripheral tissues. There are tissues that are insulin sensitive, which are the skeletal muscle and the liver, and then insulin enables that glucose to enter in them, and that glucose will deposit in the liver and in the skeletal muscle as glycogen. And as glucose enters the tissues, glucose levels in the blood decreases, and you have normal glucose levels. Well, in the fast, when you are fast, when you haven't consumed foods for 8 hours or more, you have adequate glucose levels because that glycogen that you have stored due to the consumption of carbohydrate-containing food, that glycogen is stored in your tissues, and it starts to be degraded in the liver and in the skeletal muscle. This process is called glycolysis, and as a consequence, glucose are maintained, and when those glycogen stores get depleted, liver start to produce de novo glucose, and this process is called neoglucogenesis. And then in the fast condition and in the postprandial conditions, that's how glucose regulate. So this is what has to occur if you are healthy. What happens if you have glucose intolerance? Well, first of all, we should define what is glucose intolerance. Glucose intolerance includes impaired fasting glucose, impaired glucose tolerance, and diabetes. Well, impaired fasting glucose and impaired glucose tolerance some years ago were known as prediabetes. So it's these conditions are like the previous a condition of hyperglycemia, but it's not considered diabetes, but almost. So it's like the previous step. And impaired fasting glucose means that you have blood glucose levels in the fast conditions which are higher than 100. Impaired glucose tolerance is defined as blood glucose levels that are higher than 140 milligrams after a load of 75 grams of glucose or after the ingestion of a carbohydrate-containing meal. And we also, and that's what's impaired fasting glucose and impaired glucose tolerance, as I said, was considered, received some years ago the name of prediabetes. And diabetes, there are lots of types of diabetes, but the most frequent ones are type 1 diabetes and type 2 diabetes. Diabetes is diagnosed when your blood glucose in the fast state is superior to 126 milligrams, and or if your blood glucose levels are higher than 200 milligrams after a 75 grams glucose load, or after a random plasma glucose in the postprandial period, that after whatever meal consumed, if your blood glucose levels are higher than 200, that you have diabetes. Well, why this occurs? Why this hyperglycemia occurs? Well, the underlying mechanism or of the underlying causes of diabetes and prediabetes are impaired beta cell insulin secretion and also insulin resistance. In type 1 diabetes, what happens is that beta cells in the pancreas are destroyed, and as a consequence, insulin is not produced in adequate amounts, insufficient amounts. In consequence, your blood glucose rise, they cannot enter tissues. But in type 2 diabetes, which is the most frequent type of the most common type of diabetes, what happens is that insulin resistance occurs, and in combination with impaired beta cell insulin secretion. So you have insulin resistance, your tissues don't respond to the action of insulin, so your beta cells have to produce like larger amounts of insulin, and there is a point in which your beta cell function cannot compensate for such high glucose levels due to insulin resistance. They cannot compensate that situation, and they become and they start producing insufficient insulin, and then diabetes is diagnosed. So the first step in the pathogenesis of type 2 diabetes is insulin resistance, and this leads to in the long term to impair beta cell insulin secretion, and when both of them occur simultaneously, diabetes is diagnosed. So as I said, insulin resistance is impaired, is defined as impaired biological response of target tissues, liver, skeletal muscle, adipose tissue, to insulin stimulation. They don't respond to insulin, so glucose cannot enter into these tissues, and in consequence, glucose remains in the blood high, causing problems. When an individual with glucose intolerance, prediabetes, or diabetes eats carbohydrate-containing foods, they are going to experience dramatic increases in blood levels superior to 140 milligrams due to the beta cell, impaired beta cell insulin secretion and the insulin resistance. Well, we now know that, yes, when you consume carbohydrates, if you have glucose intolerance, you are going to experience high glucose levels, but this does not mean that carbohydrate causes glucose intolerance. This means that you have glucose intolerance, and then when you eat foods that contain glucose, as you are going to experience hyperglycemia because your insulin secretion is impaired and you have insulin resistance, but the culprit here are not carbohydrates. What are the real causes of insulin resistance and impaired beta cell function? Which are the risk factors for those? Which are the hallmarks of type 2 diabetes? Well, we know that overweight and obesity are the main risk factors for type 2 diabetes and insulin resistance and prediabetes. Why? Because when you are obese, when you are overweight, when you have that excess of body fat, you are in a lipotoxic state that causes insulin resistance, because that fat is in the leads to when you have excess body fat, when you have a large adipose tissue, eventually adipose tissue becomes dysfunctional, and as a result, fatty acids are released from the adipose tissue, and they start to accumulate in other tissues, such as the skeletal muscle, the liver, and this deposition of fat, in these tissues, which is called ectopic fat deposition, creates a state of lipotoxicity and as a result, these tissues develop a strong insulin resistance. They don't this accumulation of lipids in the liver, in the muscles, alters the insulin receptors, and as a consequence, they don't respond to insulin action. So overweight and obesity are the most important risk factors in type 2 diabetes, but also dietary factors. We know that animal protein consumption, high individuals who consume higher amount of animal protein, in prospective studies, it is seen that they have a higher risk of type 2 diabetes and prediabetes. And we also know that high saturated fat-rich diet also lead to lipotoxicity, because that saturated fat deposits in the liver, in the skeletal muscle, and also when you ingest that, you experience a postprandial hypertriglyceridemia, which means that the levels of saturated fat and of triglycerides containing saturated fatty acids are that concentration of triglyceride is increased in the blood, so you experience like a postprandial hypertriglyceridemia, which impairs endothelial function. And later on, those triglycerides accumulate in the liver, in the skeletal muscle, and those tissues experience insulin resistance. And in many clinical trials, it has been seen how a high-fat diet can, in just some days, increase insulin sensitivity and lead to higher glucose levels after ingestion of carbohydrates. You know, this saturated fat leads to glucose intolerance, and as a consequence, when you eat carbohydrate food, you experience hyperglycemia. But the problem here is not with the carbohydrate-containing food, but with the foods that are causing the intolerance, that are saturated fat-rich foods and animal protein, which is which has been observed in cohort studies and in randomized controlled trials, as we are going to see. Also, red meat consumption and processed meat consumption has been linked to higher diabetes risk in many cohort studies. And what we also see is that in prospective cohort study is that when consumption of eggs, dairy products, fish, and other types of meat, like poultry, consume those animal protein sources, those animal foods, instead of plant protein sources, such as legumes, whole grains, nuts, increases the risk of type 2 diabetes. There are some cohort studies that don't see that animal foods such as dairy or eggs are associated with type 2 diabetes. There are some studies that don't find that association, but when we look at those studies, we see that those studies have not performed the substitution analysis, which means that they are not taking into account what people are consuming instead of eggs or dairy products or meat. So if you don't integrate the substitution analysis, maybe you don't see that association, because if people that consume less dairy products or less eggs consume more sugar-sweetened beverage or ultra-processed foods, we are not going to see that that population has a decreased risk of diabetes. But if instead they consume plant foods, they are going to have a decreased risk. So we have to look at those prospective cohort studies that have integrated the substitution analysis. And those studies show that replacing animal food with plant protein sources, legumes or grains, that leads to a significant reduction in the risk of type 2 diabetes, and also the risk of cardiovascular disease, cancer, all cause-specific and all-cause mortality. Also, cohort studies show that sugar-sweetened beverages are associated with greater risk of diabetes, of type 2 diabetes, and also the consumption of ultra-processed foods. Well, lots of biological mechanisms can explain this relationship, this association that we have discussed. For example, as I told previously, animal foods and processed food have a high content in saturated fats, and saturated fats in clinical trials have shown consumption of a high saturated fat diet induces changes in microbiota and gut microbiota, and as a result, there is like a passage of a component of the bacteria that is called the LPS, which is lipopolysaccharide, that this component of gram-negative bacteria translocates, and it goes through the intestinal barrier and it reaches systemic circulation. In this process, immune cells within the intestinal barrier start releasing cytokines, and they induce an inflammatory response is created, and LPS concentrations in the blood increases, and this state of inflammation is called metabolic endotoxemia. Well, lots of clinical trials have shown that consumption of a diet rich in saturated fat in animal foods compared with a plant-based diet rich in fiber induced that metabolic endotoxemia, leading to higher systemic inflammation, higher levels of LPS, and these microbiota changes, which are correlated with this increase in inflammation. Apart from that, as I discussed earlier, saturated fats accumulate in the liver and in the skeletal muscle, and has shown, compared to low-fat diets, to lead to a lipotoxic states that result in increased insulin resistance and higher blood glucose levels after consumption of carbohydrates. And also, saturated fat can increase oxidative, can lead to oxidative stress, which is particularly harmful to beta cells. Well, we also have heme iron, which is found in red processed meat, and well, there are cohort studies that show that increased heme iron consumption is consistently associated with higher risk of type 2 diabetes, and also heme iron is particularly toxic for the diabetic patient, and in fact, higher levels of iron in the blood, higher ferritin values in the blood are consistently increased with, are associated with increased risk of type 2 diabetes, and this has also been shown in Mendelian randomization studies, which can establish a causal relation. So we know that the causal relation between we know that the relation between heme iron and type 2 diabetes is causal. Also, advanced glycation and products which induce inflammation, induce oxidative stress. So 8 are found in animal foods, especially red meats, chicken, also eggs, fish. Animal foods are the food sources with the foods that contain the highest content in advanced glycation products, especially when they are cooked. When they are cooked, well, when they are raw, they still have H, but when they get cooked, their content increases dramatically. So this H induces oxidative stress, inflammation, and in clinical trials, higher H consumption has shown to impair glucose levels compared to a low H diet, such as a plant-based diet. A plant-based diet, as it doesn't include animal foods, it has a much lower content in H. And this seems to benefit that glucose metabolism. Well, also animal protein. The protein we find in animal foods has a high proportion in branched-chain amino acids, in essential amino acids, and this amino acid has been associated in cohort studies with increased risk of developing type 2 diabetes and insulin resistance. And also in some clinical trials, restriction of those amino acids in the diet results in greater insulin sensitivity and better cardiometabolic control. Well, there seems to be a link between branched-chain amino acids and type 2 diabetes. Also, dietary cholesterol. Increased dietary cholesterol is animal foods are the only foods that contain dietary cholesterol, and dietary cholesterol consumption has been also in cohort studies associated with increased risk of type 2 diabetes. And well, also we have trans fats, which are found in processed foods and also in animal foods. Animal foods also contain natural trans fats and pollutants like dioxins and mercury and all these pollutants have been also associated with greater risk of type 2 diabetes. Well, we now have, we all know about many dietary approaches that are used for type 2 diabetes, such as the high-fat, low-carbohydrate diet, like the ketogenic diet. We also have high-protein, low-carbohydrate diets, low glycemic and low glycemic loads diet. Also, like this has become very popular in the internet, like all these food combinations methods in which carbohydrate-rich foods are combined with fats, protein, and things like that, so to retard the absorption of carbohydrates, and therefore glucose levels are lower in the postprandial period. And also some studies have been carried out with using like the personal diets by prediction of postprandial glucose response. And well, these popular dietary strategies for the treatment of type 2 diabetes, it is true that these strategies can lead to lower blood glucose level. But it is true that high blood glucose levels as a result of prediabetes, of type 2 diabetes, is associated with higher risk of cardiovascular disease and mortality. Yeah, that's true. But this does not mean that every approach that lowers blood glucose levels will result in decreased mortality or decreased diabetes risk or decreased cardiovascular risk, because that dietary approach may lower blood glucose level, but increase the risk of disease by other multiple mechanisms, such as increasing insulin resistance, altering blood lipids, increasing inflammation, and in the long-term results in greater risk of disease and mortality. So the problem with these strategies is that they focus on the postprandial blood glucose response each food or meal cause, but do not take into consideration the impact of that food on other cardiometabolic risk factors such as insulin resistance, and don't take into account the effect of that food on the risk of disease and mortality. So, for example, we have the low carbohydrate diets that they lead to lower blood glucose levels, of course, because if you don't, if you restrict the amount of carbohydrates, which are the food components that provide glucose, if you restrict that in your diet, of course, that as the entry of glucose is this meat is lower, you are gonna absorb less glucose, and as a consequence, your blood glucose levels are gonna be lower. But this low carbohydrate diet, high in animal protein, and fat increase insulin resistance, as we have seen. So they promote the underlying mechanism of diabetes. So when you follow them, you think that your diabetes is better because your blood glucose are lower, yes. But what happens? But these lower blood glucose levels are not occurring due to to improve insulin sensitivity and beta cell function. No, they are improving because you are not ingesting carbohydrate. But once you include carbohydrate, you are gonna see that you are still a diabetic and you still have that intolerance. So what you want with your diet is to decrease your insulin resistance, is to improve your beta cell function. And ketogenic diets and low fat and high fat, high animal protein diets worsen those parameters, which has been observed in clinical trials. Also, high diets that are high in animal foods and fat foods, saturated fat foods, foods rich in saturated fat, to say, increase the risk of type 2 diabetes, cardiovascular disease, cause-specific and all-cause mortality. Well, we also have the low glycemic index and diet, which is a very popular approach. So people try to choose like low glycemic foods because these foods induces a lower postprandial blood glucose response. But as mentioned before, this doesn't mean that this food is gonna be necessarily healthier, because there are many foods that cause a low glycemic response but increases the risk of disease and mortality compared to other foods that may cause a higher blood glucose response. We have the example of red meat. Red meat increases the risk of diabetes even though it is considered a low glycemic food. For example, carbohydrate-rich whole plant foods such as whole grains, legumes, have a higher glycemic index than animal foods. However, replacing animal foods with whole grains and or legumes is associated with lower risk of diabetes, cardiovascular disease, cancer, and mortality. And also this approach that has appeared like some years ago, which is called like the personalized diet by prediction of postprandial blood glucose response. Well, it is true that a food, these approaches, well, choose the foods that in a particular individual cause a low glycemic response. However, food or meal whose ingestions produce a lower postprandial glucose response in an individual does not necessarily mean that it is healthier, but because, as discussed previously, it can worsen other biomarkers and increase the risk of diseases and mortality. So what's the optimal diet for preventing and treating diabetes? Well, the healthy plant-based diet, or also known as a whole foods plant-based diet, which refers to a dietary pattern that excludes animal foods and processed foods and instead focus on unprocessed plant food, that is fruits, vegetables, whole grain, nuts, tubers, and legumes. Well, why I'm saying this? I'm saying this because randomized controlled trials show that a healthy plant-based diet improves cardiometabolic parameters, that is blood glucose, fasting blood glucose, glycosylated hemoglobin, total and LDL cholesterol, insulin resistance. It reduces body fat levels and inflammation levels. Compared with other healthy diets, healthy omnivorous diets, such as the Mediterranean diet, that has been observed in clinical trials, that a healthy plant-based diet improves greater those biomarkers than other healthy diets that contain small amounts of animal foods. Also, we know that randomized controlled trials show that replacing animal protein sources, that is meat, eggs, fish, or dairy products, if you replace that in your diet with plant sources of protein, legumes, nuts, soy, that leads to an improvement in cardiometabolic parameters that I have previously mentioned, with glucose, glycosylated hemoglobin, total and LDL cholesterol, in individuals with or without diabetes. Also, prospective cohort studies shows that higher adherence to a healthy plant-based diet lowers the risk of type 2 diabetes, cardiovascular disease, various types of cancer, including breast, prostate, digestive system, lung. Also, chronic lowers the risk of chronic disease. Is associated with lower risk of stroke, cause-specific, and all-cause mortality. And also, prospective cohort studies show that replacing animal protein sources, meat, eggs, dairy, fish, with plant sources of protein, legumes, nuts, that results in a decrease in the risk of type 2 diabetes, cardiovascular disease, cancer, cause-specific, and all-cause mortality. And well, those were my slides, and here I have the paper that has been published some months ago, in which I talk about the potential of a healthy plant-based diet in type 2 diabetes. And in this paper, you can find, here it is published in Nutrition Reviews, and in this review, you can find in my article, you can find all the scientific reference in which I have based during this talk. All the scientific studies that I have mentioned are the reference is here, so they are at the end of the document. You can find, like, in the article here, you have like all it's more than 200 reference. You have everything. All the scientific studies.
Please make sure you give me an exact link to it, and I'll put it in what's called the show notes.
Yes,
Okay?
it is true that so as to have access to the complete article, you need to be subscribed to the journal, because scientific journal work in that way. But I also have ResearchGate, so if somebody is particularly interested in the article, they can write me, and yeah, and I can see how we can share. But the thing is that there are many mechanisms, as I explained also in the article, and I also there are lots of mechanisms, as I explained in the article. Well, I'm gonna
Wow, you know, you're going to be a great doctor. Now, in Spain, do you become like a general practitioner, or are you going to specialize in a certain type of medicine?
Well, you can specialize in a certain type of medicine, but the thing is that the medical specialties don't include in that. You can specialize in family medicine, or digestive, or cancer, oncology, cardiovascular. But the thing is that those specialties don't habilitate you to prescribe diet. So as to be able to prescribe diets and tell people what they should eat, you have to study the nutrition degree.
And that's what you're doing. Yeah.
Exactly, because I can specialize maybe in ophthalmology, or well, in ophthalmology, well, but maybe imagine endocrinology, or internal medicine, or oncology. But with that specialty, I'm gonna be able to prescribe medicines to those patients, having that type of disease. I'm gonna be able to offer them a medical treatment, but the nutritional treatment of those diseases is something that is in charge of the nutritionist, of the dietitian. And I thought that for me it was better to have the medical degree and the nutrition degree instead of a medical specialty, because what I want to do is to help people healthy, and people with disease, help them introduce dietary changes that can prevent disease and reverse disease, or at least improve it.
That's amazing. Your English is wonderful. When did you learn it?
Well, I learned it by myself. I started to study it when I was diagnosed with the lymphoma. I became like, I said, well, I don't know why, but I have to learn English because this is gonna be great for my future. So I started to go to academies, to English academies, and I started to get my certifications in English, which is, I have the C2 Cambridge certification, which is a proficiency, which means that I have the highest certification I can have in English, and at least in the Cambridge system. So I started to study a lot of English when I was 11, and when I was 16 years old, I obtained my proficiency certificate, and I have learned it by myself, just studying, going to academies, watching videos, and I haven't been in United States or England or whatever. I haven't been abroad, and thanks to videos, studying a lot, academies, I learned English, and right now I don't have to study English. I just read scientific articles in English. I watch your videos in English, and my level of English is maintained without problem.
Amazing. Where are you going to practice medicine in Spain, or would you like to come to the United States?
Well, I don't know. If I have here opportunities, I would stay here. But if not, I would have to go to United States because here, as I told you, the plant-based movement is not very advanced. And I don't know if my approach is if I'm gonna be able to find a job. Or, and sometimes I say, well, if things don't go well here, maybe I have to go abroad. But I would like to stay here and to be able to practice this plant-based medicine here in Spain. But it is true that I would like to go to California, meet you, and go to all the conference that lifestyle doctors organize every year. And that's my dream, and to meet all of you in person, because for me, you are a source of inspiration, and I would like to go. But these years I have been like very busy with all these studies and both degrees, but I'm trying to attend to those conference in the next year or whatever, so that I can meet you. And I would like also to visit the United States, so as to try the Hawaiian sweet potatoes, and because here in Spain, it's very, very difficult to find purple sweet potatoes, which are my favorite.
Well, you come here, and maybe you can even take a visit to the True North Health Center.
Yeah, that could be like a dream come true for me.
Well, I hope to meet you. You are very inspirational. And if people want to learn more about you or follow you, where should we send them? I know you have a YouTube channel.
Well, but my YouTube channel, the problem is that right now I'm not like publishing videos there regularly, because I'm more focused on the medical degree, the nutrition degree, and also on publishing scientific articles, because I have also made other ones that are now being peer reviewed. They are in the peer review process. One about breast cancer and plant-based diets and more. So I'm focused on producing scientific articles, so they can follow my scientific my scientific production, and they can follow me in ResearchGate. If they Mariana Fernández-Fígares, and in ResearchGate they can follow my work, and also in LinkedIn they can find me. But my articles and so on, I put them in the ResearchGate.
Well, it has been a pleasure meeting you. Thank you for being on the show, and maybe you'll become like the Dr. McDougall of Spain one day.
I hope to introduce this approach in Spain, and I hope that things improve. Yeah.
Thank you so much. Take care. Bye-bye.
Bye.